The Hotspotters program was really an idea of our police and fire that recognized the need for services for a few people in our community. And they reached out to the other health providers in the community and said, let's come up with an individualized plan for these few folks that need some special attention. And that's going to then be able to help us use those scarce resources in other places.
And so what we found out is that we aren't getting to the root of what is really going on and why they're calling 911. A lot of times they call 911 and want to be transported to the ER, but their problems extend way further than that, more than what the fire department and or the emergency rooms could handle. And so we started really looking into what kind of resources can we do to help. And one of the big things that we found out is that there are resources out there for them. We just need to figure out who it is.
We had a lot of partnerships as we moved forward, not only internally in the city hall and in the Pasco city departments, but also externally with the mental health system that we have in place here and how they are able to partner with us going forward and provide these services and help us triage those so we can move forward with getting them the best service possible.
We meet once a month here in Pasco and we discuss referrals or individuals that are already involved in hotspotters. I a lot of the times have contact with some of these individuals out on the field since I ride with law enforcement. So we basically provide updates on those contacts. Maybe it's just even seeing the individual out on the field, maybe they're doing fine. So just kind of providing those updates, kind of contributing that way.
We would make our phone calls to our local resources, we'd take them to the hospital, get them medically cleared, and that was kind of the end of it. We'd see them back out on the road anywhere within another 2 to 4 hours for most. Sometimes they would be detained and get some inpatient therapy. With the Hotspotters program, one of the great things that we see is that if needed, we can call that person's mental health counselor and they can come to the scene where we're at and start getting that person some help right then and there.
Even though you're going to front load it with some extra special attention to the individuals, well, at the end of the day, will you be able to free up some of your resources, the important police and fire aspects, to other parts of the community, other programs that need attention when you just don't have all the resources to fund everything?